back again. So whilst in type 1 diabetes, someone might end up being on insulin as a fault of no, as a result of what they know nothing about, because it's due to genetic factors and they might not know the reason why they develop it. In type 2 diabetes, which is a lifestyle diabetes, actually we have a choice in it. You and I have a choice in it because these develop over a period of years as a result of things we're doing. Diet, food choices, inactivity or less activities, accumulated obesity, right? Or the weight spiral out of control. So that can predispose us to type 2 diabetes over a period of time. And in gestational diabetes, which is a diabetes in pregnancy, most of the time, the carrier may not even be aware that they are until, like I said before, they go for the antenatal checks and their sugar came back as high. The good thing with gestational diabetes is most of the time, once the baby is born, it will reverse itself. But the big but here though is the fact that 1 out of every 2 ladies that have suffered with gestational diabetes over time will end up developing type 2 diabetes if they don't take precautions. What are these precautions? Actually taking control of those things that lead to type 2 diabetes in the first place. So whilst gestational diabetes can resolve itself after baby is born, if you don't manage that, researchers said 1 out of every 2, that is 50% of those with gestational diabetes, will end up with type 2 diabetes at some point in their life. Now, in summary, genetics play a role in type 1 diabetes. Type 2 diabetes is all about your choice of lifestyle, the choice you and I have made, nutrition, sedentary lifestyle, inactivity, less activity, or obesity, which is something that is so common these days. How many of us are now within our normal target rate, target weight? Or like I said, for the purpose of this particular course, the gestational diabetes, which is the one that occurs in pregnancy, and we reiterate again, that can auto-correct itself after baby is born. However, if the mother doesn't take necessary precaution, research says 50% will then go on to develop type 2 diabetes over a period of time again. Now, let's continue. So what are the symptoms of type 2 diabetes? What are the symptoms of type 2 diabetes? The most commonly one is actually similar to an everyday ailment. I'm tired. People are yawning. They are thirsty all the time. Now, what stands it out is the fact that they are running to the toilet like a yo-yo, you're going to pee, especially more at night. So, as a rule of thumb, I will say, because I'm talking to people within the ethnic minorities, if you wake up more than 2 times in the night to go pass urine, and you're not on night duty, that you're drinking tea or you're drinking water, you're wide awake, but you're sleeping, but you're waking up more than twice to go pass urine in the night, that is actually a warning signal. That is your pancreas warning you that I am already becoming sensitive. That is your pancreas telling you, gentlemen, we are building up to the point where I may not be able to supply enough insulin to support your sugar consumption or absorption, as the case may be. Another thing that is so subtle that most people don't talk about is the presence of what we call the tags in different places. You will see people that have tags on their skin and say, oh, I've got tags, what can I use to take this off? This is so cosmetic. Most people that develop tags, research is now telling us that your tag is a symptom or a sign that you're developing insulin sensitivity over time. That is another one. Another one that is very subtle, because in the case, for instance, I am a Nigerian. Like over 46% of people in Nigeria with type 2 diabetes are actually not aware that they have it. So you can imagine people going about day to day, sitting on deadly disease, but they don't know until something happens. And what are some of these things that can happen? Maybe they hit their leg on something, and they develop a small wound, and this wound refuses to heal. And they're going out to scatter. What the hell is going on? They check the sugar. Yes, they've got accumulated sugar over a period of time. In Yoruba language, they will say, the wound that has refused to heal. Those are one of the classic signs of someone who has accumulated diabetes over time, right? So we've mentioned tiredness, exhaustion, um, regular thirst. You're thirsty all the time, right? Excessive passing of urine during the day or more than twice at night when you're not on night duty, when there is no reason for you to stay awake or you're drinking water over the course of the night, but you're waking up, urine is disturbing, passing the need to pass urine is disturbing your sleep. Those are the classic signs of type 2 diabetes. Tag on the, you're having tag on your skin, you should be thinking insulin sensitivity. You cannot feel neuropathy. That is, you can't feel. It's like I can't feel my legs anymore. Subtle signs like pins and needles. Those are gentle signs that your sugar is beginning to build up, right? Or as the case may be, over a period of time, when some people go to, in rural areas where there is actually not proper toilets, and now I'm talking about the rural community, they pass urine maybe on the ground or somewhere in the backyard, and after some time you see, flies, insects roaming around that urine. There is something sweet in there. They are coming to check. In the olden days, our fathers, our forefathers, they say it's all sugar, our own sugar. Because the flies get attracted to your urine. It smells nice to them. These are the signs that people see that make them to suspect that something is going on. Shall we recap that? Tiredness, exhaustion, excessive thirst, excessive passing of urine, too much urine at night, disrupting your sleep, people having wounds that is not healing over a period of time, right? Disruption in sleep over a period of time, or your urine, or the smell. Even sometimes, so some people, when they pass urine, when they wake up in the morning, it smells so strong. You can almost smell the sugar in it. These are the signs that let you know that I need to go check in the hospital. Now, if you actually don't want to do all of these things, these days, there are ways of developing or, of knowing that you actually have type 2 diabetes mellitus. Easy blood checks that your doctors will do for you. And that is the best way of knowing. So if you are someone that is above 40, as a rule of thumb, one of the things you should be doing with your doctors is checking your blood check for the test they call the HbA1c. We will get there in the course of this video, but these are the things that let you know for a fact that you've got type 2 diabetes mellitus. Do you want to process that? Let's take a break.